Hi, my name is Terrence Keaney, dermatologist at Skin DC in the Washington DC area, and I'm going to be doing a Botox treatment or a botulinum toxin A treatment in a male patient. This is a younger male patient strong guy who's coming in, and with men sometimes you have to tease out why they're coming in, and he really wants to reduce these lines, but his goal is not perfection. A direct quote was he doesn't want to have a shiny, smooth forehead. He wants to soften these lines. So this is really important in your new male patient to kind of tease out exactly what their end goal is, because you're going to maybe dose and your injection strategy will be different depending on what they want. So if we take a close look at this patient, so why don't you frown your eyes together? So he has a fairly strong glabellar complex. If you take a look, his corrugators, and we're looking at that dimpling in the skin, his lateral insertion of his corrugators, which inserts into the skin, I've marked him out here, is he's not too wide, but he is strong, and he has a greater contribution from his procerus muscle, which is the central muscle, and he has, you can't quite see it, but he has almost kind of that U pattern, which kind of outlines, instead of a classic 11, there's that contribution, relax for me, that horizontal line showing just kind of a greater contribution of the procerus, and this can help dictate dosing. But given his strength, we're definitely going to be higher. I'm going to use 40 units of botulinum toxin A in his glabellar complex. So if we look at his lateral canthi, which is due to, smile for me, relax, due to the vertical fibers of the bicularis oculi muscle. Smile one more time. If you look at the distribution, so in men, it's more common to have this wrinkle pattern, what we call the lower fan. So his superior extent of the fine lines versus his inferior extension of fine lines. So he's more shifted downwards. Smile one more time. With some of these lower lines are likely due to the contraction of the zygomaticus major. So he has a downward fan pattern, which will dictate how you place the botulinum toxin injections. But also it's important to count, so you can relax, your male patients, is especially at that prominent lower fan, that some of those lower lines are due to a muscle that we do not want to treat, the zygomaticus major. So it's important to say that beforehand, so they're not disappointed if you improve a lot of the lines, but some of those lower lines are still there. That's also a great segue to introduce the concept of dermal fillers, because I find when patients, those male patients, have those prominent lower fan wrinkle lines around the lateral canthus, it's really important that sometimes a dermal filler injection in the superior cheek or in that periocular area can be very effective at improving those. All right, and then lastly, looking at his forehead, raise your eyebrows for me. He has a kind of the classic frontalis pattern where his muscle activity, he kind of is the classic dual fan with some overlap centrally. Raise up really high for me. I always pay attention to the frontal temporal peak. He has a great head of hair, but some of our male patients may have more recession. You want to make sure and identify that superior border of the frontalis so you don't leave any active muscle contraction in that area of thinning, but we don't have to worry about it with him. Raise your eyebrows one more time. So it's interesting, at rest, relax one more time. At rest, he has a nice flat eyebrow position. Raise again. You can see he has a kind of, his eyebrows sort of want to peak, and this is important because if you treat his forehead and you don't pay attention, or you don't identify the area where his eyebrows want to peak, you can accentuate that, and you can give him a more peak or spocked brow position, which most men hate. So I'm always very conscious of placing an injection point raised above, so you can see that kind of peak. You want to make sure you hit right above where his brow potentially may peak, so he does not peak. So that's his anatomy. We're going to get prepped, and we're going to start with the injection.